Welcome back. Welcome back. This is the People's Voice. I am Trey Evans and I am the People's Voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we thank everyone who is taking some time to listen to the podcast today. We do understand that you can be utilizing your time to do something else, so we do appreciate you taking some time and spending that time with us. As always, if this information is valuable, you feel it to be enlightening and worth sharing, we do ask that you subscribe to the podcast and also sign up for notifications. That way, you'll be notified when each episode is released. We do put out a new episode each and every Friday, which is heard on all podcast platforms. And we also put a video on YouTube out every week as well, every Wednesday, for those of you who would like to watch the podcast. In addition, when you do sign up for the podcast, it helps us out as well. It notifies our distributors that we have an audience that finds this information to be important and are engaged. And then in turn, the distributor then extends our reach, and that way we can tap in with additional audiences as well, so they can receive some of this, what I consider important information that we provide. But in any event, we thank you and welcome to the People's Voice podcast. So today, I want to talk about medical. This discussion is regarding healthcare and medicine here in the United States. And I'm always a little reluctant to get into the conversations around, healthcare and medicine and even financial advice and investing and things of that nature, because, you have to be so careful with the information that you provide, especially, getting an opportunity to be able to crack open a mic and to talk to people. Number one, you have somewhat of understanding what your audience is, but you never know who's listening. And then two, what you don't want to do is provide information and have someone act on it and it erroneously affects their life. So, I'm always a little bit wary about talking about medical topics. But in this case, today I want to talk about medical misdiagnosis within American health medicine. But I also want to preface, and I'll say this a couple of times probably during this podcast, that, the information that I'm providing is just that. It's information. It's not advice, specifically to your medical condition. So if you are currently dealing with a medical issue, you're having symptoms, I strongly recommend that you talk to your healthcare professional. And of course, I always recommend doing your own research as well, but in no way am I giving you advice on a specific medical condition that you may be dealing with. And I think it's important that I say that because, again, this information, I can't have it. I don't want it to be misconstrued in any way for advice, so I'll just leave it there. But today, I want to talk about medical misdiagnosis in American medicine. And this kind of piggybacks or was kind of inspired from the previous, I don't even know which podcast it was at this point, but I know I talked about the medical billing practices in healthcare, in American healthcare today. So kind of doing some research on that led to this conversation. But medical misdiagnosis in American medicine is a huge issue. And it is, in my opinion, right, underreported. There was last year some reports that came out about it, but I think, we have been so conditioned here in the United States as just individuals that, the doctor, when you go to see your doctor, he or she is the final say, if you will, on your health needs, and then um, oftentimes we don't, in my experience and in my opinion, don't do enough to either do our own research or to even seek out, second, third, even a fourth opinion, depending on what the condition is. In any event, because of this, um, there are a lot of misdiagnoses that are currently going on in American medicine. And so today I'm going to talk about, not only what that looks like, but, some of the cost, how many people are being affected by it. And then, of course, some recommendations on how you can kind of address this with your healthcare professional or in your own life. So I think the best way to do this is probably to define what medical misdiagnosis is. And I was reading an article from AARP, and they did a great job in kind of covering this as well. But one of the things that they did was they gave a definition for what is medical misdiagnosis, and I think it's important that we start there. So, a medical misdiagnosis is when a medical professional incorrectly diagnoses an illness or a medical condition, um, leading to inaccurate treatment. And it's important to kind of stop there, leading to inaccurate treatment. So you can have a medical illness or not have a medical illness, and you may receive either not enough treatment for that medical illness, incorrect treatment because you've been misdiagnosed with the wrong problem, or in some cases you may have an illness and be overtreated, right? Receive unnecessary surgeries or medicine, things of that nature. So I think it's important to highlight that. Misdiagnosis is when a medical professional incorrectly diagnoses an illness or medical condition leading to inaccurate treatment. This can cause, and again, I'm reading this definition from AARP, this can cause additional, if not catastrophic, costs to the patient, delay proper treatment, and worsen the condition. Misdiagnosis also occurs when physicians don't diagnose anything, assuring you that all is well. So I think it's important just to kind of get that baseline of a definition so we understand what medical misdiagnosis is. I thought in that definition, obviously the inaccurate treatment, but another important piece to this, which, sometimes we go to the doctor not realizing that, this is a service. It says here it can also lead to cost to the patient. And, as I've always said on this podcast, everything in America costs money, everything. And that's including your health. So when these misdiagnoses take place, this costs you as a consumer, as a patient, a lot of money. Matter of fact, in that same article from AARP, they highlighted the cost for what that costs on an annual basis. And they in this piece from AARP, they quoted a study that was, or a report that was provided by Stat News, and it says that the cost of medical misdiagnosis to the U.S. healthcare system may be as high as $100 billion, and that's billion with a B. So this is costing not only money to individuals, right? But it's costing money to the overall healthcare system because, of course, you start getting into medical mispractice, lawsuits, and things of that nature. But just so you have an understanding, this medical misdiagnosis not only can harm you and your health, but it can lead to serious cost for patients as well. In addition, last year, like I said, there was a report that came out. There was a report done by the British Medical Journal, better known as the BMJ Journal. It is a journal, it is an international peer-reviewed journal, and peer review meaning medical professionals who review cases in that industry. The BMJ, there was a report done by a doctor who is associated with, he was associated, I believe, with Johns Hopkins. Yes, David Newman Toker. I hope I'm saying his name right. David Newman Toker. He's the director of the Center for Diagnostic Excellence from Johns Hopkins Medicine in Baltimore. And in his report that was published in the BMJ, and again, the British Medical Journal is a peer-reviewed journal. It's been around since 1840, like well over 150 years. But in that report, he highlighted how many people per year are affected by this. And so reading from that report, it's estimated, and I'm reading directly from the report, it's estimated that 795,000 Americans become permanently disabled or die across care settings because dangerous diseases are misdiagnosed. And this is directly from this report from the British Medical Journal that was reported last year. In addition, now that, and I don't want to brush over that, that's 795,000. Let's just call it 800,000 people annually. This is every year, okay, in the United States are affected by misdiagnosis, which can lead to permanent disability or even death. And I'm highlighting this because we know, and I say we as American citizens, we have been told pretty much my entire life that the American health system is one of the most elite health systems in the world. When you hear these type of disturbing numbers, it raises concern, I know, at least for me, and I'm sure for those of you who are listening, about, just how accurate are the medical professionals, specifically in today's medicine. And that 800,000, 795,000, that's kind of a median, if you will, in terms of a number, because in that same report, it's noted that, the range could be anywhere from 598,000 to well over 1 million people. But the 800,000 was kind of the range. 795 was kind of the range that was settled on. But in any event, that's a lot of people. And typically, from what they see in terms of, some of the most misdiagnoses in terms of issues, they say stroke, pneumonia, and lung cancer are among some of the top ones that are misdiagnosed in terms of the medical profession. In addition, there's been other reports that have, stated that number may be as high as $12 million. 12 million misdiagnosis a year may occur. And I'm reading this from that same article from AARP. It says the Society to Improve Society to Improve Diagnosis in Medicine states that in the U.S., more than 12 million diagnostic errors occur annually, with 1 in 3 causing serious patient harm. So I'm highlighting all of these things because, as I'm been very consistent. I'm a numbers guy, right? And so when I see the numbers, I know one thing.
Men lie, women lie, the numbers don't.
And because those numbers don't lie, this, in my opinion, is alarm or a reason for raise the alarm, to ring the alarm, and for concern. So what can you do, right? This is the information. This is currently occurring. What can you do? Well, there was an interview done last year on News Nation, and they interviewed Peter Pitts. He's a former FDA associate commissioner, and he gave some pretty strong recommendations on what should occur between doctor and patient. And so I want to play that, and then I'll give some additional recommendations that I've read here, and then we'll close out from there. But let me play this piece from this interview, which I thought was great information, and then we'll close out.
Well, I think what patients need to know is they need to be part of the solution. When a doctor gives you a diagnosis, you have to ask, what other options did you look at? What does that mean? Are there tests that we can run? And then the problem, of course, is that a lot of doctors have their hands tied by insurance companies who don't want to pay for diagnostic tests or other second opinions. They want the patient to be in and out of the office as quickly as possible. And I think that's really at the root of the problem. Doctors are feeling the pressure to be rushed to get the patients out of the room and get to the next one. And that's got to be addressed. It's serious business.
That is.
And as I said, I thought that was great information. And again, that's Peter Pitts, who's a former FDA associate commissioner. And as you heard, he said two key things. Number one, to his point, you want to question your doctor, your healthcare professional, when you receive a diagnosis. It's not a one-way street. You should be able to say, okay, I understand what you've given me. Now let me ask you a set of questions. And then secondly, which is the huge one for me, he talked about the insurance companies. And the insurance companies, as we know, depending on what type of insurance you have, but specifically in medical insurance, even if a additional test is recommended and the insurance company says that they don't want to pay that out, you do have the ability to protest that, right? And there's a whole process on that, and I'm not going to cover it in this particular podcast. And in addition, you yourself can pay for that test. And listen, I know, right? Everything is expensive, but when it comes to your health, that's inexpensive, especially there's no price on that, especially when it comes to whether or not, a test can determine whether or not you would have to, go further in a surgery or on a medication. So, sometimes we have to consider, is what I'm trying to say, sometimes we have to consider paying out of pocket for some of these tests, even after an insurance company, for those who can, let me be clear, for those who can, even after an insurance company denies the coverage or, won't pay for that particular test. So I thought that was great information from that interview. Again, that's Peter Pitts, former FDA associate commissioner. Some other things that you can do, and then I'll close out from there. Again, going back to that article on AARP, and again, this comes from Dr. Newman Toker with John Hopkins. He says there's 3 suggestions on how you can reduce chances of a medical misdiagnosis. Number 1, come prepared. It says because of lack of time, doctors don't have time to spend with each patient because, the medical profession has become like an assembly line when it comes to seeing patients. So there's no more really bedside manner. It's kind of like, here's what I think the issues are. Here's what you should do. Thanks for coming out. See me in 90 days, right? It says because of the lack of time doctors have to spend with each patient, the doctor has to give a quick executive summary. They give few details. You need to come prepared to ask questions. It says a few key details of what conditions you had before the onset and a list of medications you are taking. So when you get into that consultation with your doctor, you need to say, well, this is what I've been feeling. Here's what I've been taking. So at least the doctor is equipped with a little bit more information and not just giving you the standard, this is what this person has, and typically it's A, B, C, or D. Ask questions, as the doctor said, as Mr. Pitts said in that interview. You got to ask questions. Ask the doctor, if they give you a diagnosis, could it be anything else? What's the worst you think this could be? What do you think it's not? Asking questions is going to produce additional answers, which then equips you with additional information for you to do your own personal research, even after the doctor visit, to get a better understanding. And then remain vigilant. If your treatment is not working, consider that you have the wrong diagnosis, not just the wrong treatment, because you can be diagnosed. And matter of fact, in this article, they talked about a situation with a woman who was diagnosed with diabetes, but ended up dying from what did she die from? She ended up dying from pancreatic cancer. And even though they were treating the diabetes, the pancreatic cancer was not diagnosed, and she ended up dying from that. So, you got to be vigilant, and we have to be diligent about our health and take just same accountability about our health that we do with other areas in our lives, and ask those needed questions to make sure you're getting the correct answers to ensure that it is not costing you, and that, of course, ultimately you do not have to lose or seriously disable your own life. So that's what I want to talk about today. Hope this information was valuable. As always, if you want to leave a comment, you can reach us on any of the social media platforms. I can be reached at I am Trey Evans on all social media platforms, or you can reach us at the People's Voice Podcast on Instagram. Please leave a comment. We'd love to hear from you, and we will definitely respond as soon as possible. So, as always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute.